usually I see a story, something like, I've spent $20,000 to $120,000 on this condition. Nobody can figure it out. I see everybody in this how to open and run a clinic industry talking about how to charge more, how to charge patients more, right? Well, I don't see anybody teaching how to actually get the result that the person came to for. When you have a mechanical issue that doesn't show up on x-rays and MRIs, you're in checkmate, medical checkmate. I find in here, it's tragic. In that paper, I documented, I asked each one of those 19 patients, have you ever thought about, and because a lot of them told me, so I knew it was a yes anyways, but when I wrote the data up, I asked them, and this 57%, over half, had told me they contemplated ending their own life from this condition. I've seen people with just heel pain, and I've seen people with just knee pain, no back pain. And of course, I screen their side joints, open up, boom, gone. And I'm like, yeah, no, this is coming from your back. Hey everybody, what's up? Physical therapist, Dr. Ryan Welton, coming to you from just outside the really hot Tampa Bay area. If you are new to following me, I have a chronic pain clinic. I have a clinic where most people, I would say, come in here and say, nobody knows what's wrong with me. They accuse me of making it up, that kind of thing. And the failed, usually I see a story, something like, I've spent $20,000 to $120,000 on this condition. Nobody can figure it out. I've been teaching for the better part of a decade on here, maybe more. I've been teaching people how I get the results that I get in here. I get exceptional results in this patient population. I am not concerned at the least bit treating chronic pain patients. I have come up with diagnostic methods. I have come up with protocols. I have published things. You can go to my website, Whelton, wheltonmethods.com, and you can take my online courses where I go in depth. I also publish papers dealing, my root cause of SI joint dysfunction, root cause of sacral torsion shear, root cause of plantar fasciitis, root cause of posterior impingement syndrome in the shoulder. I have published these papers because I was trying to help my colleagues understand what is happening to these poor people that go through literal hell trying to get someone to even believe them that they have an injury. So before I get into that, I am teaching. Whelton Methods is changing. Okay, so all my courses are online, but I also have a membership program. One of them is free, so you can just go to wheltonmethods.com, Whelton methods.com, and go to the drop down for courses, become a VIP member. Okay, and you can join my VIP inner circle. One of them is free, where I teach live with live Q&A. I'm trying to get us diagnostically up here and get, to be able to help these poor suffering souls of this world that find themselves extraordinarily challenged in the medical system of someone trying to even diagnose, let alone believe them about what they're going through. Okay? So I am also going to be teaching, switching gears and teaching in a very structured format business, how to open and run one of these businesses. Everywhere I went in the country when I taught live, someone would come up to me and ask me, will you teach me how to run one of those businesses that you have, cash-based clinics in Tampa, Florida? And I would say, no. And then finally I was like, you know what? If I can teach this and how to market it, and then, we can bring these chronic pain patients in that a lot of them have nobody, they gave up going to doctors, and we can bring those in and you apply my protocols, what I do in here, and I get exceptional results. That's what I do in here. So I like to be of use to society. I don't like to just be another voice in society. So I like to be of use. I'm a very practical thinker. And I see everybody in this how to open and run a clinic industry talking about how to charge more, how to charge patients more, right? Well, I don't see anybody teaching how to actually get the result that the person came to for, at a relatively high success rate, like in here. And that's where I come in. So I am going to teach business and clinical at the same time. I am going to not only teach you everything, the financials, accounting, marketing, all of it, how to get the certain patient population in here. I'm going to teach you what I do in here and how I get the results that I get, my protocols. I'm going to teach you diagnostics. We'll do it all, okay? And that, check on my website and I'll be announcing it, so stay tuned. But that I am going to do, and I'm going to help. I'm going to get these type of clinics that understand chronic pain. My goal is all over the world. I already have helped numerous people open and run them, but I'm doing a much more structured format and really, really focus my attention on that. Okay, so just join my school group, SKOOL school group. And that's my VIP inner circle, and I'll announce it for sure in there. Okay, now I want to talk to you about this patient that I just saw. So nowadays, people fly to me from all over to see me. So I don't just see people from an hour and 2 hour drive away here in Florida. I see people that fly in here. And this particular patient was a young girl. She's a teenager, and she's a volleyball player and can no longer play volleyball for a year. And she has seen, her parents thought, 12 doctors. And then drum roll, she was actually referred to a psychiatrist. And the reason why I say drum roll is because I tell this story about this psychiatrist from a major university email me and say, thank you for your publications and your teachings on SI joint dysfunction. I was able to help myself after years of having this. And then I started checking my chronic pain patients in my psychiatric office, an MD, right? Guess what I found? And I'm like, I know what you find, because they tell me all the time in here. They tell me all the time that they are referred to psychiatrists for making it up. This person's got psych issues. They're making it up. Send them to a psychiatrist, right? And then they come in here, like this girl today, and they're out of pain in less than a minute. So this case, let's go over this case. So a teenage girl, okay, has low back pain in here, okay? And then they do, they scan you up the wazoo, right? And they found a slight bone chip, not a listhesis, but a bone chip. So they went in and they took it out. And the patient got worse. And then she started to get, on both sides, the referred pain chart of SI joint dysfunction into the heel. Okay? I told you it can go into the foot. Okay? And the reason why I wrote that in my paper, that it can go into the foot, including weakness, foot drop. I documented in that paper that I published of 2 YouTube videos where you can watch it happen, where a person went from like 3 out of 5 strength or something to 5 out of 5 right in front of your eyes as I open up an SI joint. Now, this young lady can no longer play volleyball for a year, and because she's in so much pain. Okay, they did surgery on her back, which she said made it worse. And they kept asking the doctors, show me. Eventually, the mom, really smart, she said, show me what you're talking about. And she's like, they couldn't really show me because they couldn't really figure anything out, what was happening. And when I saw her chart, okay, and if you fly to me, then you're usually desperate. So when I saw that somebody flew in from, across the country, and they have low back pain and pain down the legs, I knew what was wrong. And the reason why I knew what was wrong is because I do this all day long. I hear the same stories, which is why I am out here screaming my head off to my colleagues that we need to save these people. There came a point in my career, in 2009, I had figured out an SI joint patient, this young girl, actually, I figured out what was happening at her SI joint, but I'm dyslexic. Dyslexics are known for pattern recognition. An intelligence agency in the UK actually recruits dyslexics like 3-to-1 over normal thinking people because we're known for pattern recognition and we are insightful. And I started to, this pattern popped out at me, and I'm like, all of my patients coming here are coming in with UpSlips, out flares, and then their tailbone's twisted. They have a sacral torsion. And I'm like, and I kept seeing it over and over again. And it took like a year or two before I was like, this is the most common cause of the patients coming in here. And I do it all day long, all day long. I see these patients come in and they spend like $20,000 to $120,000 on it. They'll tell me, had it for years. I think I have one lady right now, 20 years of it. Seen everybody, right? You know, and then I know what they have. I just need to get my hands on and confirm it by relieving their pain. Because when you relieve their pain by realigning their pelvis, it tells you exactly what's wrong, right? So anyways, so this girl had back surgery as a teenager. It made her worse, she stated. She had low back pain and then pain on both sides that went down all the way into her heel, okay? And she is in such pain, she cannot play sports anymore. And when I saw her, what I did is I said, I knew what I was about to see because, like I said, I do this all day long. And I know so many of you are doing this. And I teach people how to open and run clinics based on this. And like a physical therapist in Iowa is like solely treating SI joint. And he has a very, very good practice. And he got out of being an employee. Now he's an employer. And he just does this all day long too. And he told me the other day, he is not worried about these people. He actually told me it's extremely rare. I was on the phone with him the other day. It's extremely rare I can't get these patients out of pain using your methods and protocols. Okay? So here's what I did. So you find the PSIS, those are the knobs in the back. You have to learn to palpate that. When I traveled this country, people were having trouble finding this. So the knobs, where your thumbs flop over them, okay? I asked her to extend back, and my left thumb translated superiorly on the PSIS and my right thumb inferiorly. They are both supposed to translate inferiorly. It was slipped up like this. And this is why these people are in so much pain. It is shearing bone pain. These people have shearing bone pain in their back, and they're getting referred to psychiatrists, like my patient today. So for making it up, that's why they're referred. So I pulled on her leg, okay? Brought that back down into alignment, okay? Long axis move. Take my courses. I show you exactly how I do this, and watch my videos on YouTube, Whelton methods, or Spotify, or even Apple Podcasts. And I pulled on her leg. I brought it back down. I laid her on her sides, and what I was doing was this. I was gapping the out flare open. So I was pressing medial on the ASIS, okay? I also rotated her tailbone back. So if you read my paper on sacral torsion shear, or take my online courses, which I go much more in depth on it, is when I had her bend forward and standing, or you can do it prone, but they have to relax their glutes, then my left thumb dipped in. And if you were going to say your right thumb dipped in, send me the video. I want to see it. Because follow up with a 90-90 piriformis strength test. Because for some reason, these people I find have all their right piriformis is weak, causing it to twist this way. Okay, so we have to strengthen the right side to bring it back. So I had her bend forward. My left thumb dipped in, which told me that she had a sacral torsion, and that was shearing at the base of her spine. Does not show up on x-rays and MRIs. And I pulled on her leg. I gapped open the out flare, okay? Rotated her tailbone back. She stood up. She said, I'm still in pain, okay? Extending back, bend forward, right? So then I put a ball, like a kickball, in between her knees, like this, and I had her squeeze. Normally that does the trick. Extend back, bend forward. Is the pain still there? No. But in her case, it was. So not only did I have her squeeze the kickball, but then while she was squeezing with her feet close together, you have to do that because otherwise you can't really squeeze it that hard, is I pushed medial on her both ASIS while she was squeezing a kickball. You got to get the UpSlip first. Okay, if you don't get the UpSlip first, this doesn't work. Like this, squeeze medial, extend back and forward, boom, pain's gone. This person was not making it up. This person, unfortunately, had run into, she had a mechanical issue. And when you have a mechanical issue that doesn't show up on x-rays and MRIs, you're in checkmate, medical checkmate. I find in here, it's tragic. It's tragic what I see in here. But we're the ones that fix it. We are, people in my profession love to call themselves biomechanical experts. I say, are you? Because she went to physical therapists who were having to do single leg raises who were hurting her. And the reason why they was hurting her is because that is how you shear an SI joint. And she didn't need to strengthen her core. She needs to realign the UpSlip, out flare, and her sacral rotation. Now, when I had her do a 90-90 strength test, she was 5 out of 5 here. Could not break her on the left side for her piriformis. And then her right side was like 3+ maybe. And that is why her tailbone twisted and was causing shearing pain at the base of her spine, is because of this asymmetry, okay? So if you don't know which side the sacrum twists, which I always say the left thumb dips in here. I do this for a living. I do hundreds of these evals a year. And it's like a miracle if I see it with my right thumb translating towards the stomach or anteriorly. But you can just check, put them in a 90-90 and check their piriformis strength. And then you know which side to strengthen, which I always strengthen the right because that's always the problem in here. Okay, so now the problem with her was mechanical, okay? And I just proved that. So before I published that paper, we all heard the SI joint doesn't move, humanity's screwed, which is silly. Now, I published that paper, and now those papers have gone viral. They're considered, I plugged it into AI, the amount of reads it gets 3 to 5 years after, and they're considered historic papers. So if you are not using, that's free. If you are not using this, my question to you is why? Why wouldn't you use this? If you have something that works better than that, share it. Share it. Because I do this all day, and I just got on the phone with a physical therapist from Iowa that has a whole clinic dedicated to SI. And he says it's extremely rare I can't get somebody out of pain immediately. So, and he gets them better. He doesn't even charge you like I do if for the initial consultation. We do an initial consultation. He doesn't even charge you if he can't get you out of pain. And he specializes in low back pain that nobody can figure out. That's his specialty in Iowa. His name is Josh Stewart. He is an awesome physical therapist, and he's in Ankeny, Iowa. Now, what do you do about it, right? So this person has a sacral torsion like this, okay? So I proved it by testing her 90-90 piriformis strength test. So I strengthen the right side only, okay, and bring it back into alignment, okay? And the UpSlip is gluteus medius weakness, so I strengthen that, bring it back down. And then I call it the straggler in this rehab, SI sacral torsion rehab, the mechanical back pain tragedy. And you strengthen the groin muscles, but there's a system to do it. You can take my online rehab results course or read my papers. I go much more in depth in my course, but I outline in my papers how to do this because it is it's the last thing to strengthen, I find, is groin weakness, okay? Okay, so I expect this young girl to be better. Kids heal fast. I expect her to be better in 5 to 8 weeks. They're usually not those long haul SI patients, kids. So after all of that, 12 doctors, a surgery that made it worse, she said, okay, and a referral to a psychiatrist. So yeah, no, I'll come out here and I will scream about this until there's no air in my lungs because I see this tragedy on a regular basis. Every week I sit across from these people. They sit right here, and a lot of them cry when they describe it, or they tell me they gave up going to doctors, or they had all kinds of surgeries, and they're worse or no change. And I start thinking this is SI as soon as I start to hear what I call the story. And if we all screened for this, we can prevent this tragedy and get these people out of psychiatric clinics for told they are making it up. Because I published that paper on sacral dysfunctions and SI, mechanical back pain, and I put specifically to bring awareness to what is happening to these patients. I put specifically in there that 57% of the 19 patients that I outlined in that paper had contemplating ending it all. That's what happens to these people. So if I sound passionate about it, like people say, oh, physical therapists promote life, doctors save lives. That's not what we're doing, with these mechanical back pain patients. Because in that paper, I documented, I asked each one of those 19 patients, have you ever thought about, and because a lot of them told me, so I knew it was a yes anyways, but when I wrote the data up, I asked them, and this 57%, over half, had told me they contemplated ending their own life from this condition. It's crazy, literally crazy. And because they go to everybody and they eventually can't stand up, can't sleep, can't roll over in bed, can't sit on certain surfaces. Those are the 3 questions you have to ask these patients. Does it hurt to roll over in bed? Does it hurt to sit on certain surfaces? And when you sit for a while, is it hard to get up, like in the morning? Because it's locked down. And I've sat and I've listened to these people for years, and those are the 3 things they describe to me all the time. Okay? And they are describing mechanical back pain in my patients. Okay? And you should check these people for this. It is straightforward. This isn't fluff. Anybody that knows me, anybody that follows me, no, I'm not into fluff. I'm not into some theoretical framework or whatever. Like, just try it, man. Just try it and save these people from a lifetime of suffering or psychiatric medications when they actually have an orthopedic issue, like this young lady today. So I fully expect her to get better. I am not worried about it, but I knew what she had as soon as she started describing it, because I hear this story every week. Every week I hear this story, I would say. It's insane, literally insane. Anyways, save the mechanical back pain patients. They have like save the whales and all this stuff. Like, I feel like putting a sticker on my car that says save the mechanical back pain patients, because it is a tragedy what happens to these people. Like this girl, 12 doctors, a surgery that made it worse, and a referral to a psychiatrist, physical therapist and chiropractor. And the physical therapist made it worse because they were shearing the person's SI joint without understanding what happens at the SI joint. Okay? Anyways, that's that. But check every patient. I don't even care if it's in the thoracic spine. I've seen it refer up there into the foot for SI joint dysfunction. Clear that over everything. And then you can say, oh, well, this is a straight up knee issue. Okay? That's how I think. Or an ankle issue or whatever, You go in with heel. I've seen people with just heel pain. And I've seen people with just knee pain, no back pain. And of course, I screen their SI joints, open up, boom, gone. And I'm like, yeah, no, this is coming from your back. And then the one person had meniscal repairs on both, and the surgeon said it was a success. And they came to me and they said, I'm the same, and I screened their SI, boom, gone. Pain's gone, rehab them, they get better. So, okay, there's no excuse. I published that paper for free. And stay tuned. If you ever thought about opening and running a cash-based business, I will walk you through step-by-step and literally not only teach you the business aspect of it, I will teach you the clinical aspect of what I do in here, okay? And that, to me, is a hole that is missing. Everybody's trying to charge more money, but no one's talking about results that I see. No one's talking about, did you provide the service that the person came to you for? Because what's the point? What's the point? So anyways, that's that. I will help you, transition from from an insurance to a cash-based model. Anyways, that's that. But go on to weltonmethods.com and join my VIP inner circle. One of the groups is free, and I am teaching live with live Q&A. Okay? Peace. Love you all.